Module 3, Returning to Work. First things first, it should be noted that the college has put together a number of policies and guidelines for your protection while you're at work. Some of these policies include Policy HS16 COVID-19 Workplace Recovery, Mandatory Vaccination Policy, Mandatory Use of Mask Policy, Occupational Health and Safety Guidelines, and COVID-19 Orientation Training. College preparations. It's important that all employees understand that while you were working from home, the college was busy using essential services to make sure that the college is prepared to welcome employees back for re-entry one day. Some of the things that the college has done is conduct rigorous cleaning and disinfection of all campuses, work to secure and implement the necessary controls, i.e. engineering, administrative, and PPE, to keep employees safe, adopting strategies to support remote academic instruction and other work and services where possible, adjusting policies and procedures to help accommodate this new reality of COVID-19, and ensuring that training and awareness activities are available to all areas. Stay away if you are sick. It's really important that all employees understand that if you are experiencing symptoms of illness that are consistent with COVID-19 symptoms, do not come to the college. If you have a sudden onset of symptoms while at work, immediately tell your manager and then leave to go home, practicing physical distancing as you leave the building. Work from home if you can. Working from home is a strategy that helps minimize the number of persons on campus. The college is promoting working remotely, but this needs to be authorized by your manager based on operational needs. Hand hygiene. The importance of effective hand hygiene is the most significant control measure that can be applied to minimize the spread of COVID-19 and cannot be overstated. It prevents the transfer of infectious material from the hands to the eyes, nose, and mouth, or to other surfaces that are touched. It's important for all college employees to wash your hands before leaving the work area, before eating or drinking, when returning to your work area from other areas, after handling materials that may be contaminated, after visiting the washroom, or when you get home from work. How to wash your hands. If you're washing your hands with soap and water, please make sure you wet your hands under warm running water. Apply liquid soap, then lather and rub your hands for 15 to 20 seconds. After that, rinse your hands. Towel or air dry your hands, then turn the taps off with a towel or your arm and sleeve. If you're cleaning your hands with a hand sanitizer, place a quarter-sized drop of alcohol-based hand sanitizer in your palm. Rub your hands together, palm to palm. Rub the back of each hand with palm and fingers of the other hand. Rub around each thumb. Rub the fingertips of each hand back and forth in the other hand. Rub until your hands are dry, at least 15 to 20 seconds. Note that the college only recommends and only deploys alcohol-based sanitizer that contains at least 60% alcohol. Don't touch your face. Avoid contact between your hands and your mouth, nose, and eyes at all times. Properly wearing a face covering, such as a cloth or non-medical mask, also helps by preventing you from touching your face. Cough and sneeze etiquette. It's important that all employees understand that sneezing or coughing is known to spread droplets much further than the normal verbal interaction. Cover your mouth and nose with a tissue when you cough or sneeze. Put your used tissue in a wastebasket. If you don't have a tissue, cough or sneeze into your upper sleeve or elbow, but not your hands. If not immediately washed, your hands will spread the virus to other surfaces. Personal non-medical masks. You must wear a personal non-medical mask. These masks can help reduce infection spread from you to others if you are infected. Follow directions for the proper use and care of non-medical masks. Physical distancing. Taking steps to limit the number of people you come into close contact with is really important. Limiting personal contact through physical distancing is a highly effective way to reduce the spread of COVID-19. Advised by public health agencies as a practice that should be promoted at all times throughout the college. Physical distancing. As you're aware now, physical distancing has been promoted by all public health authorities. The guideline is 2 meters, 6 feet between individuals. This reduces the likelihood of transmission through normal contact and through droplets expelled during normal verbal interactions. Implementing physical distancing. Our capabilities for physical distancing can be enhanced through broad strategies to reduce the number of people or increase the space available. Working from home and providing support services through remote capabilities minimizes staff on campus. Remote academic instruction limits the number of students and faculty on campus. And applying reduced occupancy limits for classes and other spaces increases the space available for individuals, i.e., introducing a 40% of typical occupancy limit. Implementing physical distancing. Some additional measures for implementing physical distancing may include adopting a preference for remote delivery of services, academic and support, and remote business practices, either working from home or remote attendance at meetings. When persons are on campus, adopting customs and preferences for remote activities rather than in person is preferred. Using floor markings to support physical distancing requirements. Restricting activities and access to the buildings, and specific areas limit the number of people present in a space. Establishing alternating on-site days or using extra shifts that reduce the total number of employees in a facility at a given time are all examples of implementing physical distancing. The signs of change. In this slide, you'll notice a number of signage that you will now see throughout the college campus. These signs are to help promote physical distancing and help limit the spread of COVID-19. Cleaning and disinfecting. It's important that all employees understand that the college has increased the frequency and the nature of the surfaces that are cleaned and disinfected to help reduce the spread of the virus throughout the campus. Cleaning and disinfection is not a solution by itself and should not be relied on over frequent hand washing. Frequently touched surfaces are most likely to be contaminated. Facilities management and the college cleaning contractors use hospital-grade cleaners on all college surfaces and touchpoints on a rigorous schedule. These cleaners will be made available to all college areas. Cleaning personal workspaces. Commonly used cleaners and disinfectants can be effective against COVID-19. Use only disinfectants that have a drug identification number or DIN number. A DIN number is an 8-digit number given by Health Canada that confirms it is approved for use in Canada. Check the expiry date of products you use and always follow the manufacturer's instructions. Cleaning personal workspaces. Clean frequently touched surfaces twice per day. Surfaces that have frequent contact with hands should be cleaned and disinfected twice per day or when visibly dirty. Examples of these include doorknobs, elevator buttons, light switches, counters, handrails, touchscreen surfaces, and keypads. Check with your department or area for any specific protocols for cleaning for COVID-19 that are included in revised work practices. Personal protective equipment, or PPE. As previously discussed, the use of PPE to provide protection from a hazard is generally intended as a last line of defense between the hazard and the contact with a worker. The use of PPE should never be considered in place of other control measures, but in addition to the use of other control measures. PPE is only effective if it is used correctly. This includes the fit, use, care, maintenance, cleaning, proper wearing, and understanding the limitations of PPE. Doing your part. Employees can do a number of things to ensure their safety while on campus. Getting fully vaccinated. Washing and sanitizing your hands regularly. Not touching nose, mouth, or eyes. Cough and sneeze etiquette. Adhering to physical distancing and cleaning your personal workspace. Properly wearing PPE that is required. Adopting changes that contribute to reducing infection risk. Promoting these techniques with coworkers, and avoiding activities that increase infection risks. Exposure to COVID-19. Any employees who have symptoms of illness that are similar to COVID-19 or have tested positive for COVID-19 should immediately stay home and self-isolate. Advise your manager. Your manager will then advise occupational health and safety, and appropriate measures can be directed within the workplace based on the circumstances relating to the exposure potential. Employees should then follow all directions from Ottawa Public Health to manage their illness and determine their testing and health needs. Employees at our Perth and Pembroke campuses should follow their local public health guidance. Exposure to COVID-19 in the workplace. If you experience immediate onset of symptoms while at work, please advise your manager immediately that you are unwell. Go home and follow guidance from Ottawa Public Health. Complete an accident incident report online. Exposure to COVID-19 in the workplace. Managers and supervisors of an infected employee should immediately shut down the work area office where the infected employee works. The manager or supervisor will consult immediately with OHS regarding an investigation to identify if there are any potential exposure risks. The manager and supervisor will be required to collect all necessary information identified for reporting an occupational illness. Facilities management may be required to conduct a deep cleaning or sanitization, or potentially close the area for 72 hours. Exposure outside of the workplace. If any employee is exposed to COVID-19 outside of the workplace, they need to follow the Ottawa Public Health guidance that is posted on the website and take extra care to follow personal hygiene and other preventive measures as outlined in this document. Employees must inform their manager and advise of the precautions they have been provided by their health provider or public health authority. Community tracing. In the event of a college-based infection, we may have a role in assisting community tracing events with public health authorities. There are a range of strategies that the college can adopt to assist in tracking activities, such as taking attendance for classes, taking attendance for business meetings, strategies to reduce cross-campus travel by staff or students, gathering names at controlled access points, and limiting the number of access points to buildings on campus. Accident, injury, illness reporting. It's important that all employees understand that reporting an illness is no different than reporting accidents. All employees of the college are required to report any accidents, injuries, or exposures to their immediate manager or supervisor. Policy HSO5, Accident Reporting and Investigation, states that all accidents which involve personal injury to an employee and accidents which result in damage, loss of college property must be reported using an accident incident report form. None of this changes with the onset of COVID-19. Accident, injury, and exposure reporting. It's important that all managers and supervisors ensure that first aid, medical treatment is provided as required. The accident incident report is completed with the employee. The accident incident report is signed by the supervisor and is forwarded to Occupational Health and Safety. Accident incident reports can be filled out online via the following link. Work refusals. Can employees refuse to work? Yes, but the validity of the refusal is subject to occupational health and safety legislation and interpretation by the Ministry of Labor. The worker must immediately tell their manager or supervisor that the work is being refused and give an explanation of the circumstances for the refusal. The manager supervisor must then investigate the situation immediately in accordance with the Occupational Health and Safety Guidelines for work refusals, which involves members of the Joint Occupational Health and Safety Committee and Occupational Health and Safety. Are employees covered by WSIB for COVID-19 infections? It's possible, but the assessment of whether the employee is entitled to compensation would be determined by WSIB on a case-by-case basis. WSIB will assess whether the COVID-19 infection is an occupational disease, i.e. the illness was caused by or arose out of and in the course of employment. Amid community transmission of COVID-19, a wide range of potential exposure sources may now exist, creating challenges in establishing work-relatedness when adjudicating claims. Evidence must show that the person's risk of contracting the disease through their employment is greater than the risk to which the public at large is exposed, and that the work significantly contributed to the person's illness. Mental health and stress. A confirmed case of COVID-19 in the workplace will cause anxiety among coworkers, and some may become stressed. There needs to be clear communication, and it's important that directing workers for reliable sources of information about COVID-19. Managers should be supportive, understanding, and exercise flexibility related to work assignments to the extent possible. Mental health and stress. Employee Assistance Program, or EAP, is available to help you and your family deal with personal issues, tensions, and stressful situations before they lead to more serious problems. Use your smartphone to stay connected to your family and friends. Shift from texting to voice or video calling to feel more connected. Practice stress relief whenever you feel anxiety building. Deep breathing, exercise, reading, passing the time, or hobbies. Avoid unhealthy behaviors that ultimately may lead to an increase in your anxiety. Thank you. This concludes our presentation. Should you have any further questions or concerns, feel free to visit the link below to the Algonquin College Coronavirus website. At any point, if you have further questioning, feel free to consult with Occupational Health and Safety.